Hi, I'm Dr. Zach for Emerge, bringing medical education to the masses, and today we're going to talk about heart attacks. Now, a heart attack is when the blood supply to the heart gets blocked. Now, you may think, well, all of my blood goes through my heart. How can it possibly get blocked? Well, it turns out that the blood that goes through your heart, the blood that gets pumped, is not the blood that gives the oxygen and the nutrients and the glucose to the heart. That comes from very small vessels that come right after the heart called your coronary arteries. Now these can get blocked from something called plaque, cholesterol plaques that can build up along those arteries. And when enough plaque gets built up, the chance of one of those breaking off because of the turbulent flow over it increases. And so at some point, that plaque breaks off, can push up and then cause a complete occlusion, no blood getting to the rest of your heart, and this is when you can have major problems. So in the ER, how do we look at this? How do we diagnose someone with a heart attack? Well, our first clue can be with the EKG. The EKG looks at the electrical part of the heart, the electricity that it uses to conduct through the heart to make it beat. Now, when there's not enough nutrients, something called ischemia of the heart, then the EKG can change and it can look different, and so that can give us a clue. The second thing we can look for is something called a troponin. A troponin is a small molecule that can leak out of the heart when it dies, when small parts of the muscle dies. And this can give us a clue that there's not enough oxygen or not enough nutrients getting into that part of the heart. But sometimes it's not totally clear, and sometimes we have to do other things like stress tests on the patient, or even do an angiogram where we stick a needle into their groin, go up into their heart, and start shooting some dye in to see exactly if there are any blockages. So that's how we diagnose this. How do we treat it? Well, treatment includes blood thinners, things that can block the plaques from breaking off, things that can make the blood more smooth so that a clot won't form. These include aspirin. These can even include other things that are stronger antiplatelets, or even medications that thin the blood further. Overall, the best thing for heart attack is prevention, healthy living, keep your cholesterol low, control your blood pressure, treat your diabetes, and that is the best management. All right, next up for Emerge, stroke.